Our fifth speaker, I'm racing ahead of myself here, is Sue Gregg. Sue is a public health consultant who works jointly with NHS Sheffield and the City Council. She's also Sheffield's Sexual Health Commissioner, and Sue's going to talk to us about what's happening in the population and HIV and AIDS in Sheffield at the present time.
Thanks very much. It's a real privilege to be speaking to you today. I think it's very clear from what the other speakers have said that HIV/AIDS remains a major public health issue globally, nationally and locally here in Sheffield. HIV infection is preventable and it's now very treatable. So it's of serious concern that the latest Yorkshire and Humber figures show a doubling of new diagnoses per year over the last 10 years, from 2001 to 2010. In Sheffield, in 2010, we've got 547 people receiving HIV treatment and care. We can take some encouragement from the fact that the proportion of people affected in Sheffield is lower than nationally, and it's lower than most other comparable large cities, for example, Leeds, Liverpool, Manchester. Also in Sheffield, the number of new diagnoses each year has remained constant over the last 4 years and has declined since 2005. And we've got some early indications of a further decline in the first half of 2011. So these are some encouraging signs that the safe sex prevention message and the work that we've heard a bit about this evening, which is really important to equip people with knowledge and skills to be able to avoid risk. We've got some encouraging signs that that is making a difference. So who's most affected and at risk in Sheffield? Overall, more men than women are affected, and this proportion, about 60% of new diagnoses were accounted for by males in 2010, and that's been increasing slightly in recent years. In terms of groups who are affected, we're also seeing a bit of a changing pattern in the last 5 years. Black Africans account for over half of patients currently receiving treatment and care, the great majority having acquired their infection abroad. However, over the last 5 years, we're seeing an increasing proportion of new HIV diagnoses in the white population and a corresponding decrease in new diagnoses in Black Africans, so a changing pattern. Again, in the last 5 years also, we've seen a change in the pattern of how HIV is passed on within the population. We're seeing a decrease in the number of infections acquired by sex between men and women, although that's still the route for the majority of cases that are currently receiving care in Sheffield. And we're seeing a corresponding increase in new infections acquired via sex between men. In 2010, sex between men accounted for 40% of new diagnoses. So alongside the need to continue our focus on prevention, we do need to get better at finding and treating undiagnosed HIV infection as early as possible. And Steve's already mentioned it's estimated that up to 25% of people currently infected with HIV are unaware of that. Late diagnosis leads to more complex treatment and poorer outcomes. And of course, it also means that people unaware of their infection can unknowingly pass that on to others. Currently, around a third of those diagnosed in 2010 came forward for testing after the point at which treatment for the infection should ideally have begun. So we've got quite a high proportion of late presentation in the city, which we need to really address. So we need to increase both the offer of HIV testing and increase the take-up of tests when offered. And other speakers have mentioned the issue of stigma. Services are working hard to combat the stigma still associated with HIV/AIDS. And we won't widen access to testing and treatment unless we really can address that issue. And communities can be encouraged to take up the offer of HIV test when it is offered. HIV is preventable and it is treatable, and we can make a difference. And there are some encouraging signs that some of the really good work in the city, the excellent services that we have and the outreach work, the work within communities, some of which you've heard of tonight and you can certainly see in the stalls that we have here. some of that work clearly is making a difference. I think World AIDS Day and events like this really put a spotlight on this major public health issue. And it reminds us all, I think, how important the task is. Thank you.
Thank you, Sue. Our sixth speaker is Dr. Karen Rogstad, who is a consultant physician at Sheffield Royal Hallamshire Hospital working within GU Medicine. And she's going to talk to us about the medical advances made to tackle HIV and the future of treatment.
So I'd like to thank the organisers for the honour of actually asking me to speak at this vigil. As a junior doctor, I was involved with the very first HIV trials when we were giving AZT, a very toxic drug, at high, as it was then because it was a very high dose, to people who were very sick. And after the initial hope we'd have for a couple of years, our patients really improved, and then they deteriorate and die. It was very devastating to be involved with that. However, after those initial disappointing results, by 1996 there was the breakthrough with triple therapy, which has revolutionised care for those who can access it. A little bit back who we are. The Sheffield Teaching Hospitals Foundation Trust, we care for more than 780 people living with HIV, and they attend either the Department of Genitourinary Medicine or the Department of Infection and Tropical Medicine. And we are the principal treatment centre for the whole South Yorkshire HIV network, which is a linked service across the whole of South Yorkshire, which provides high quality care to those who need it. We are constantly looking to improve our services, and that's one of the things in the future that's really important. We've brought in point of care testing so people can have a diagnosis the same day if required. And we've set up a transition clinic for young people, those who are infected in childhood, as they move to an adult setting. The other thing we're doing is we're setting up a lay expert advisory panel called LEAP, and there's a poster over there. And I'd like any of you who are living with or caring for somebody with HIV to apply to be a member of this panel. You would be able to help design services, participate in what research we should be doing, and looking for how we can make things better. I'm going to talk about the future now, and the key areas of interest and optimism. And I am optimistic about what's going to be available in the future. The things that are interesting are, one, we've got new therapies coming through which will have less toxicity and greater tolerability. Two, I'm looking forward to the outcomes of studies looking at earlier treatment at higher CD4 counts. We're part of the trial looking at that at the Hallamshire Hospital. Should people start treatment earlier? Will it cause long-term health benefits? Because a lot of the effects of HIV aren't just the immune system, damage to the immune system, it's the activation and the inflammation that causes problems, and we're looking, can we help prevent that? Third area of great excitement is treatment as the main means of preventing transmission. And one recent study has shown more than 90% reduction in transmission from an HIV-infected person to the regular partner through them being, the patient being on treatment. I mean, that's fantastic. There are also studies underway on the option of treating people who may be at risk of HIV infection to prevent them acquiring it. Again, another exciting development which we need to know more about. 5, I'll mention vaccine studies. I'm more hopeful than I was a few years ago about that. What I'm hoping is over the next few years that the vaccine studies ongoing will replicate the data from Thailand, and also will improve the outcomes there, because that data isn't good enough. We need it to be better. In the future, I'd like to see my role as an HIV specialist to be much more about preventing long-term health problems so that people can reap the benefits of their drugs. However, the main thing we all need to do, we all need to improve testing. because to reap the fantastic benefits and health gains and quality of life gains of the drug treatments available, people must, and to prevent transmission, people must be diagnosed early. For every single person who's diagnosed at the stage after they should normally have started treatment, they lose 15 years of their life, just wiped off. What a waste. 15 years when they could see their families grow up, 15 years when they can enjoy their life. And I think we really have to do something about that. And it's up to everybody to try and think of ideas of improving how we can improve the testing. Finally, to finish, I'd like to thank all of those patients, some of the people I've looked after, others all around the world who've taken part in trials, because the results of those trials have given us the treatment we have available now. Some of the people on the early trials had no benefit at all, but they've given the hope to people now for the future. Thank you.
Thank you. And our last speaker this evening is Katie from the Red Cross Society at the University of Sheffield. The Society has been leading a campaign all of this week to raise awareness of HIV amongst the student population. And you'll see that they have a display on one of the stalls tonight showing campaigns from the past and how they very much differ from the campaigns of today. So the Red Cross Society will be speaking about their work with and for students.
During this week, we've had a number of HIV and AIDS awareness events, which have been very different in nature to the kind of campaigns that were around 30 years ago. As mentioned before, on our stall, we have featured an ad campaign from 1987, which uses the Grim Reaper to represent HIV and has a very morbid message, which does not encourage discussion about HIV and AIDS and the people affected by it. The Grim Reapers were taken to represent gay men, which takes away from the issue which is that HIV can affect anyone at all, and does not reduce stigma or the stereotypes surrounding HIV. 30 years later, it has completely changed. For example, in our awareness events, it is all about discussing HIV, getting the issue out in the open and reducing the stigma attached to it. The stall where we played interactive games, we've got the map behind you all, in which we put the numbers of people affected by HIV in the world and mix them up, and people had to kind of put them back on correct where they were, to highlight the difference between the stereotypes and the reality surrounding HIV. We also had a speaker event which involved the charity Shield, who are here today as well, and a HIV positive speaker talking about their experiences and struggles living with the infection, perfect examples of this. Getting people involved and talking to those who have been affected by HIV. Students in Sheffield are such a large part of the community, and we think it's really important to get them involved in these kinds of events, because they can spread the message and we are the future generation. We've been really encouraged by the amount of societies who want to get involved and support the cause. Students come from all kinds of backgrounds, and some of them will have been affected by this infection. It is also really important to have these kinds of events in the student community, because young people especially find it difficult to talk about the challenges that they face if infected or affected by HIV and AIDS. Looking to the future, we think that the growing awareness needs to continue. Even though we are the first generation to grow up with a widespread sex education programme involving some of the awareness of HIV and AIDS, it is still lacking and the stigma has not gone away. This should be a major consideration in the years to come.